Hello, everyone. Welcome to IDFA's Immunology Insight webinar series. Tonight's webinar is titled Winter Safety for Immunodeficiencies, Practical Approaches to Reducing Infection Risk and Staying Well During Winter. As we head into the winter season, we know this can be a especially challenging time for individuals and families living with immunodeficiency and complex health conditions. So this evening's webinar brings together both that clinical expertise and lived experience to explore practical, realistic, and evidence-informed approaches to reducing infection risk during winter virus seasons while still approaching and supporting individuals in everyday life. So this webinar will be recorded and is made available on the IDFA website following the session. All attendees are muted for tonight's session. However, we do encourage you to submit questions throughout the webinar using the Q&A function. Okay. So before we begin, we would like to acknowledge the people, traditional owners of the Dharawal land on which we are presenting from today, and pay our respects to their elders past, present and emerging. We extend our respect to any Aboriginal and Torres Strait Islander people who are present with us on this webinar this evening. The Immunodeficiencies Foundation Australia is a member-based organisation representing people living with both primary and secondary immunodeficiencies. So we are a national peak body supporting a community of more than 2,000 members. Our vision is a future where immunodeficiencies are diagnosed early and managed effectively, and where individuals are supported by clinicians, community and government to achieve the best possible quality of life. Our work is guided by 3 key priorities, which includes education and awareness, care and support, with a strong focus on building community and advocacy to help drive meaningful change. We really hope tonight's webinar provides some practical information and support for individuals and families navigating winter safely. We'll begin tonight's session with a presentation from Associate Professor Alberto Pinzon-Cherry, who will discuss some practical evidence-informed approaches to reducing infection risk during the winter season. So some of the topics that will be covered include getting ready for winter, understanding how viruses spread, simple ways to reduce your risk, vaccination considerations, navigating higher risk situations, finding a balance that works for you and your family. And then following Alberto's presentation, we'll hear from IDFA member Joanna Reynolds, who will share her lived experience of managing infection prevention within a household affected by immunodeficiency and other complex health conditions. Jo will discuss some practical household strategies that have worked for her family, including approaches to ventilation, indoor air quality, managing shared spaces, and balancing risk reduction with maintaining quality of life. Following both presentations, we'll move into an audience Q&A session where we will have the opportunity to explore some of your questions in more detail. Our aim this evening is to provide some practical information, some useful strategies and reassurance to help individuals and families feel more confident and prepared as we move through the winter virus season. So before we begin tonight's presentation, I'd like to warmly welcome Joanna Reynolds, who will be speaking a little later in the session. So Jo is a patient member of IDFA and lives with a complex web of comorbidities, who is also a parent to children with rare disease and complex health needs, including one child with immune deficiency. Jo spends a great deal of time advocating within health and education systems and supporting other patients and families navigating complex care. So clean air and respiratory infection control measures are an area of particular importance to Jo, both personally and as a parent. Jo will share lived experience perspectives and practical strategies that have helped her family navigate winter and reduce infection risk in everyday life. So thank you, Jo, for joining us this evening. Our first presenter this evening is Associate Professor Alberto Pinzon-Cherry. Alberto is a pediatric clinical immunologist and allergist based at the Queensland Children's Hospital and in the private practice. So he combines clinical work, research and trainee education and holds academic appointments with Griffith University and the University of Queensland. He is also the Queensland representative for ASCIA and serves on the Clinical Immunology Committee for the International Union of Immunology Societies. I'm getting tongue-tied, please excuse me. We are so very grateful to have Alberto joining us this evening to share his expertise and practical insights. I'll now stop talking and hand over to Alberto to begin tonight's presentation, but thank you so much, Alberto. Please take it away.
Perfect. Okay, thanks, Hannah, and thanks, Joe, and everyone. And of course, very grateful for the invitation. Of course, I guess initially the disclaimer is present there for you. Presentation is intended really for general educational purposes only, and is not personal medical advice. Of course, many of you watching these and listening would have varying degrees of immunological deficiencies. And so it's important that you are speaking directly to GP and specialists, particularly regarding your own individual circumstances. So the views that I will be expressing tonight will be my own, and they do not necessarily represent those of the Queensland Children's Hospital or my appointments at the university or ASCIA. Okay, so I'll start really very briefly by highlighting what makes winter challenging. And of course, this is common sense to many of us, but the question really is around what makes it so much more difficult for many of us, and why do we get more illness and more disease burden? Of course, there's a couple of things. You're all aware the virus is spread more easily in cold weather, and this goes for those that are of seasonal transmission, like the influenza and RSV. But similarly, it extends to those that are of perennial transmission, like now the SARS-CoV-2 or COVID-19. Dry air allows virus droplets to hang on in the air for longer. And of course, during the winter months, we tend to spend more time indoors. And we tend to spend more time in close contact with those we love, but also people that we have to interact with on a regular basis. And so there's more close contact and proximity. And the other thing that is really interesting is that the cilia, which is part of the epithelium, the lining in your airway, that is very effective at removing and trapping those germs and getting rid of them, they don't work so well in the cold, dry air. They tend to be less efficient. And if you combine all of these, it really makes it a fact that spreading is much more likely in these circumstances. There is limited ventilation, there's more people, there's more interaction, there's the cold, dry air. And because of that, then we tend to find more illness and at times more severe illness. There's a couple of things. And of course, the point of tonight is really to try to identify some practical steps. I'm going to be very pragmatic about these. And of course, the science behind we'll just briefly touch on, but it's more about the pragmatics of it. So we can go to the next, Hannah. So my personal opinion is that the best way to approach these is a layer approach. Rather than focusing on an individual factor or an individual risk that you want to minimize, it's better to develop protection layers. As you probably know, one strategy is usually not enough. I'll highlight the couple of things that I think are key. You should stay up to date with vaccinations. And my personal opinion is that this is certainly one of the most important first layers. You have to consider, of course, that many of us that have immunological disorders will be on medications that modify the immune function, including even immunoglobulin replacement therapy. So it's important to understand that. The other thing that is key is practice good hygiene, hand washing and cleaning surfaces, taking the necessary steps for cleaner air, ventilation, and etc. And similarly, when you are sick, to stay home and to wear a mask and to avoid others. And finally, of course, to seek health care promptly if you have any significant risk factors. We will discuss briefly wearing masks in crowded spaces and physical distancing from sick people, and of course the possibility of testing when you have symptoms, as that's come about particularly now after the COVID era. So we'll go into those. Now, vaccination is the most powerful protection and is the most effective way to prevent infections, as it does induce long-term protection. And the concept behind this is that, of course, we are able to generate immunological memory. There are key vaccines that can be considered, and I'll highlight the most important ones there. The annual influenza vaccine. I tend to recommend, of course, the injected killed vaccine, not the intranasal influenza vaccine, which is a live attenuated virus, and sometimes it gives us illness. But much rather that you inject, which is absolutely inactivated. The COVID vaccine is also very important because it does protect against serious illness. It's not a vaccine that prevents infection. It's not a vaccine that prevents catching the illness. But what it does help us with is minimizing the severity of that illness if we were to contract COVID-19. Pneumococcal vaccine, on the other hand, has been shown to be dramatically efficient and effective at minimizing infection by all of the different serotypes of pneumococcus, and so prevent a number of infections, all of the sinopulmonary issues that sometimes we have to deal with, pneumonias, sinusitis, ear infections, and so on. And the RSV vaccination for eligible groups. Again, as I mentioned earlier, it's important to be mindful of the fact that many of you may be on immunoglobulin replacement therapy, and so you are receiving passive immunization. And so you're getting those antibodies through those infusions. But antibodies are only part of the answer. And those are the vaccines, some of the ones that I mentioned earlier, they work by targeting another part of the immune cell, the immune system, which is the T cells. And so it's almost, again, a complementary approach. Now, another important concept is that all family members and household contacts should get vaccinated too. And this is simply to create that protective bubble, is the concept of cocooning those of us that are at high risk. And live vaccines in general terms, but not always, this is important to discuss with your immunologist, should not be given to those of us that have immune deficiencies. But again, I'll highlight this, that is important, that we all have different characteristics. Thanks, Hannah. So I highlighted here, for example, some of the recommendations about the influenza, essentially the annual influenza shot, and then we recommend that for most of us from 6 to 12 months and above. The COVID vaccine, similarly, pneumococcal vaccination, which is now part of the National Immunization Program, but of course we recommend boosters for those of us that are at medical risk, as well as the RSV vaccine that is important for those of us that are increased risk. And importantly, of course, as you may have seen, pregnant women, as they are able to provide some of that protection to their newborns. Now, moving on from vaccination, then, of course, hygiene is key, and hand hygiene is very simple, but again, is key. Is the single most important measure to reduce infection risk apart from vaccination. How to wash your hands properly, you all know very well, but of course, you need to wash your hands when, before and after eating, preparing food, using toilets, changing nappies, coughing, sneezing, and caring after somebody who isn't well. And of course, after you touching surfaces in public spaces where you are concerned that there is significant infection risk. And of course, after the COVID pandemic, we're very familiar with the fact that if we don't have soap and water, we can definitely use alcohol-based sanitizers. Another thing that is important for us, and moving on to when we have symptoms, is to cover essentially coughs and sneezes. And the idea here is really, as you know, that you're minimizing that spreading risk. And it's a natural etiquette to implement this, and you can protect yourself. There's different ways of doing that. But it's important that you also wash your hands afterwards. And I highlight these also to some of our families to teach the children this habit quite early as they learn from example. But it's one of those that sometimes goes unnoticed, and it's certainly quite useful. Now, moving on to how to reduce then those germ hotspots, it's important to try to remove them, particularly by cleaning some of those surfaces regularly. You're all familiar with this: door handles and tapware and light switches and tabletops, and of course, mobile devices and tablets that sometimes even find their way into bathrooms and toilets and so on. Really important to clean regularly. Shared toys and learning resources, particularly for those little ones, the toddlers and the infants, that like to share them. And of course, they saliva and they drool over each other, and then they obviously share the common infections that they get. So a simple, quick wipe down with disinfectant can help certainly address these. And of course, washing your hands after cleaning. And again, this is something that it's obviously at parental discretion, but trying to teach our little ones to put this in place for themselves as part of their hygiene, the same as cleaning themselves, cleaning their hands, trying to be clean with their environment. Now, ventilation is key, and I understand that Joe may be talking a little bit about this, but of course, you know, fresh air is like a medicine. Good ventilation reduces germ concentration in the air. Opening windows and doors, getting plenty of fresh air outside each day is important. Spending time with others, ventilate the room. And you know, of course, that fresh air and sunshine are quite important. In fact, the sun is able to effectively kill a number of pathogens, for that matter. And you know, for instance, mold, that sometimes can give quite significant complications with respiratory illnesses and infections, is not able to survive in those circumstances where you're able to get fresh air and sunshine and you get rid of those mold spores. And the other thing, of course, is going outside and bundling up and going out for family walks and nature walks, as we know that exercise keeps the immune system strong, and of course, a healthy mind. Now, how can you help your immune system naturally? I won't go into the specifics of medications as such, as many of you would have those conversations with your attending immunologists, but there's simple things that we can do. Diet is key. I have given this recommendation: eat the rainbow. In general, if you eat colorful fruits and vegetables and foods, you tend to find more vitamins and antioxidants than if you go for the white breads and chicken nuggets. Of course, to stay hydrated is important. Prioritize sleep, to keep moving, and of course, vitamin D, which is effective and very essential for us, having that exposure, of course, through the autumn and the winter months. Now, when someone is unwell, it's important then to protect the whole family. It's key to discourage unwell people from coming in, and you ask families to keep sick children at home. That's a standard recommendation, of course. But if you or someone becomes unwell, rest and drink plenty of fluids. And most viral illnesses can be treated at home. This is very important. As you probably know, the majority of the illnesses that we will catch, that we will acquire, would be respiratory. And the largest burden is going to be respiratory viruses. And antibiotics will not help us to treat them. And so just manage them accordingly, usually at home, and rest is enough. But the problem that many of us encounter is that the viruses are the first hit, and then the bacterial infection comes as a second hit. So knowing when to seek medical advice is key. If you're at risk, it's important to talk, of course, with your local medical officer or with your GP if you're worried about the symptoms. And the common things that you will find is that you are usually, with viral illnesses, we tend to find improvement in symptoms, but then we get an acute worsening with recurrence of fevers and moist cough and congestion and difficulty breathing, for instance, and then that will lead to a significant concern. Similarly, if you have found yourself getting rid of your fevers and then suddenly you develop fevers again and you're not feeling well, that suggests that there is something that we need to assess and certainly seek medical assistance. If you live alone, you make sure that someone knows that you're feeling well so they can check that you're not getting worse. Now, masks and avoiding crowded spaces is an optional recommendation. Face masks in crowded spaces, we recommend that you wear if you want extra protection. Times is recommended to avoid busy crowded spaces where viruses can spread easily. And the practical approach that I tend to recommend is to wear a mask in public transport or sometimes in crowded indoor spaces during the winter months. But it is important that this is a choice. It's not a must, it's an option. And you can make it your choice based on your risk level. household members should also practice hygiene. And from that point on, my apologies, that was my little sausage dog. From that point on, then, of course, I do recommend that you stay connected, but you stay safe. Now, this is something that I will highlight and I put right at the end. And the reason for this is that we need to understand our own individual risk. We are not all affected by conditions that have the same risk factors or the same complications. And so understanding your type of immune deficiency is key. And some of us are high risk and others to certain conditions. Some of us are more susceptible to viral illnesses and some to bacterial infections or even fungal infections. The other thing that is important is what sort of medications are you on? What immune suppressants may you be receiving, like, for example, steroids or biologics, chemotherapy, or other medications that suppress the immune system, like methotrexate or azathioprine and similar. The other thing that's important is the age, where we know that older adults and younger children tend to be more susceptible to infection. And those of us that have other comorbidities, other health conditions, where, for instance, we've had involvement of the lungs, or we've had other involvement of, for example, the heart, or we have diabetes or gastrointestinal issues, where we would have more significant issues if we were to get infected. Smoking damages lung defenses. We know that very well. And so the personal risk assessment is key. And so that I need to emphasize together with the first slide, which is the multi-layer approach. Now, individual risk can be assessed in this sense. And so my suggestion is that when you discuss with your immunologist your specific risk, particularly and any medications that you feel will affect the immune system, what medications and what vaccinations are specifically recommended for you, and what are the red flags, what are the warning signs. Many of us would have certain warning signs. If, for example, we have a moist cough that is developed for more than 2 weeks, we need to seek assistance. But some of us, for example, if we start developing, let's say, for argument's sake, recurrent issues with inflammation in the mucosa, or if we have relapse and recurrence of fevers, then we need to seek medical attention. Now, in a way to try to obviously provide some takeaways to keep things simple for you, I highlighted the things here that I think are important and that have some evidence to it. The layer protection seems to work. There's no single strategy is enough. Vaccination, in my opinion, is foundational. Masks can help in specific situations. We highlighted those. And testing and treatment is important. And I did not spend too much time on early testing, but it's something that obviously with the onset and the availability of rapid antigen testing has come more available for many of us. But the concern, of course, in many of those circumstances is that if we do the testing and we're not medically assessed, we may be missing out some of those red flags and some of those warning signs. So that is something that I think it's important to bear in mind, but I wouldn't necessarily put a lot of emphasis on that. And of course, talk to your immunologist about your specific risks. Pick 2 or 3 strategies. It's important to pick up the ones that you think you can put in place and the ones that are more important for your specific circumstances, and to seek care promptly if you have any of those risk factors. And finally, I should say that balance is very important. It's important to protect, but also to live your life fully. Thank you for your time.
Thank you, Alberto. Thank you. That was so practical and informative. So thank you so much. And I think the concept of the layered protection and that realistic risk reduction is something that many of our members and their families will definitely find particularly valuable. So thank you so much for sharing that. I'd now like to hand over to Joanna, so to share her lived experience and her perspective and some of the practical strategies that have worked within her household. So thank you so much, Jo, for joining us.
Hi, I'm Jo, and I was diagnosed with the primary immune deficiency only about 3 years ago, but I've had long-standing, very complex health problems going back decades, and my immunologist is fairly sure that I have in fact had an immune deficiency my whole life, putting together family history. And one of the unexpected things that's come out of both that diagnosis, but also my experience of living in Melbourne through the beginning of the COVID pandemic, is that I actually now get infections far less frequently than I used to, despite the fact I am more only recently diagnosed with an immune deficiency. And I put that down, the reason for that reduced infection rate, down to the various protections that my family learned to put in place during COVID. And in fact, I say during COVID, during the height of early COVID, because COVID is still with us. It's not over, it's not gone. So what we learned during the early stages of COVID, particularly living in Melbourne, where I really noted what Dr. Alberto had to say about, climate and why cold months are worse. And it was one of the things I was very aware of living in Melbourne through 2020 and 2021, is there was a very clear pattern about when we had small outbreaks in different states of Australia, how different it was, like how quickly or how slowly or how with what degree of difficulty they were dealt with. And that was often put down purely to the public health efforts in given states. But it seemed to me that it's a very different thing with the climate and the architecture and behaviours that come from the climate and the architecture in Queensland versus Melbourne. And a lot of that is down to weather and airflow and in buildings and that kind of thing. I'm sorry, I'm rambling. So we really changed our behaviour over the last 6 years. And as a result, I have had COVID only once out of the last 6 years, and I've had almost no colds. I haven't had the flu. I'm actually doing a lot better because of the measures we've put in place, and so is the rest of my family, particularly my family members who are as careful as I am. Not all of our children are as cautious as my husband and I and our youngest child is. So what I wanted to talk to everyone about tonight is that I feel like the messages that we've been getting from public health for decades is a real focus on hand washing and droplet theory. And what we've really learned over the last 5 or 6 years is it's increasingly clear that a lot of infections are, particularly respiratory infections, are airborne. According to the Australian CDC, this includes influenza, COVID, RSV, like all of the common respiratory viruses that you might get tested for if you go to the doctor and they think that you've got a respiratory virus and do a swab. They're airborne. That doesn't mean we don't want to also be washing our hands and be careful with surfaces, but it means it's really important to my family to have airborne measures in place and always front of mind. And one of the problems we have is I don't feel like public health messaging has really caught up with that. So we've had to do a lot of advocating with, for example, my children's school, with friends, and sometimes with friends that I would expect to know more than me. You know, I've got a number of friends who are scientists working in medical fields. One of whom is currently going through cancer treatment and sent me a message over the weekend that her daughter has come to spend the day with her because her daughter is sick with a serious respiratory illness. And I was just like, what are you doing? So the message isn't out there as much as I would like to see. But there are many quite simple, practical ways to protect yourself from airborne infections. And the next slide is talking about things that we do in our family. The first thing is we got an air quality monitor. We have one, an Aranet 4. It's a small thing. It's easy to carry around, so you can take it, you know, in your bag in public places and see what the air quality is like where you are. Air quality monitors don't measure viruses in the air. They measure CO2 in the air, but it works as quite a good proxy for how frequently the air is being changed. So if the number, a lower number is better, the higher the number is, the more other people's air you're breathing back in. So you like to, outdoor air will be somewhere between 400 or 500 if the air quality is okay where you are. Numbers above 800 to 1,000, you're breathing quite a lot of other people's air, and it's actually not very good for your brain and your concentration. Like there are studies about the standard of CO2, air quality that you need to have good concentration for good learning in school, for example, even ignoring infection risks. When you start seeing the numbers on an air quality monitor head up to 2,000 or more, like you might on buses in particular, buses are some of the um, most appalling places you can be in terms of air quality. They're small, confined spaces, and particularly like the tour buses with that are air conditioned and kind of snap, the doors close and you can almost feel the pressure change. Those buses have appalling air quality. So buy an air quality monitor, and it can really help you inform your choices about, well, I'm in this space and the air quality here is almost as good as outdoors. I don't need to be so careful, or I'm on this bus and the air quality is appalling. I'm not going to take my mask off to have a sip of water. You can make choices that are guided by what you observe on a monitor. In your home or in places that you have control over, use air filters, like HEPA filters. They work. It's really helpful. And if you know that someone in your space is unwell, you might make choices about moving your air filters from, just somewhere in the corner of the room to placing it between yourself and someone that's unwell, or to change the dynamics of the air in your space. Use N95 or better respirators as much as you can. I myself, as Dr. Alberto said, everybody has to make their own risk assessments. I'm immune deficient. I have myasthenia gravis, which is an autoimmune disease that affects my respiratory muscles, amongst other things. I also have a paralyzed right diaphragm and adrenal insufficiency. And I have heart failure. So while I'm doing quite well at the moment, the general consensus amongst my treating specialists is that any respiratory infection could go very rapidly, quite horrendously wrong for me. So I am meticulous in avoiding respiratory infections, and that's working for me. So I myself basically never take my N95 off while I'm indoors in public spaces. And I don't actually feel that stops me from living my life in any way. I go anywhere I want to go, I just wear my mask. I don't eat in public, but when we go out to eat, we sit outside. And in most places now, that's quite possible. So I still eat out. I still go places. I just wear my mask. And I don't find that I get a lot of comments about that. I don't make a big deal about it, and nobody else does either. And the final thing that I wanted to talk about is you can control the airflow in your house when your family members are sick. And that is, I think, one of the most important things that we have done in our family. Everyone in my family, at the very least, wears masks on public transport. My husband and my youngest child and I wear them more than that. But when someone in our house is sick, we're really careful about isolating them, and we're really careful about airflow within our house. And the result of that has meant that we haven't had a forward transmission of any respiratory infection within our house once we knew that someone was sick. We have on a couple of occasions had forward infections from a sick person from before they knew that they were sick. So, we could tell by the first person that got sick who was patient A, and there's been patient B and possibly C. And in all cases, those infections have been passed on in the car. So again, small, tight air spaces are some of the highest risk places that you can be with other people, including your own family, especially if you don't know that they're sick yet. which now brings me to the bulk of what I really wanted to talk about tonight is what we do in our family to control the air quality in our household. So quite early in Melbourne's lockdowns at the start of COVID, when we realized that, we had a credible exposure of one of our family members, my husband went to Bunnings and he bought a couple of exhaust fans like you put, in the wall in a toilet or a small bathroom or in the ceiling, and brought them home and installed them not into the wall or the ceiling, but into a cardboard box, which was then inserted into a window. And I've got so this is my dog through the hole in the cardboard box as he was getting ready to insert the fan. Um, this was made from a bike box with a box cutter and gaffer tape. Like, these are just basic things that anybody would have at home. And we literally had the bike box at home in the garage, but they'll often give them away for free in bike shops, and they're usually really quite large pieces of cardboard and quite robust. So they're a really good example of a box to use for making something like this. And so he made the sort of inset box that's into the larger piece of cardboard. And then the large piece was cut to fit the specific window that this particular one went into. But we made a number of these, and over the next couple of years, we refined our system more and more, where we would have one set of fans blowing in one direction in the window of a sick person's bedroom. And so in the sick person's bedroom, the fan would be set up so that it sucked air out of the room, which meant there was always pressure sucking air in through their door and out through their window. And we always made sure that no one would walk past that window on the outside without a mask as well, because we knew that sick air was being pushed out those windows, and that, you don't want people just wandering past thinking that they're in fresh outside air when they're right outside a sick person's room that's actively pumping the air out through there. And the other rooms in the house, particularly if we wouldn't do this in every window in the house, but if there was someone, for example, in a bedroom quite close to the sick person's bedroom, they would have a fan mounted into their window, sucking air in through their window, so that the air was always pushing out of their room into the hallway that was shared with the sick person. So the next slide has a picture of it's jumping around. There's a couple of videos of these working. Oh, it really doesn't want to go on that slide, does it?
Sorry, let me try again, Joe. 1 second.
So this is a fan mounted in a window, and while he was actually assembling it, you can actually see him turning over the fan on the right-hand side. So this is just like, the fan was $35. We had the cardboard box and the gaffer tape, and it's a simple, cheap thing that you can do yourself to control the airflow in your room and have confidence that, if someone in your family is really unwell and you're needing to go in and out and be opening the doors all the time and looking after them, you want to be sure that you're not letting a whole lot of virus-laden air out into the hallway every time you open the door to take them a meal or take their temperature or check on them or do whatever you need to do to look after that person. And my husband in particular was very, very sick when he had COVID. And I was needing, despite all my own risks and health problems, I was needing to go in and check on him and make a call about whether he needed an ambulance or not a number of times a day. And probably we should have called an ambulance and we didn't. But with all of this set, so we had the fan in the window sucking the air out, and we had the air filter at the door, directly outside the door of the room that he was in. And I always masked up very carefully and then, removed and disposed of the mask each time I'd gone in and out of the room. And despite how incredibly unwell he was, I did not catch COVID from him. My first COVID infection was over a year after that. So simple technology, which you can do yourself, has been really helpful to us. And you can see that it was literally a bike box. The bike is quite visible from the outside of the house. I'm sure that this was of no end of entertainment to our neighbours. And that's really all that I particularly wanted to talk about. This is the summary of what I've already said, which is that you can use just one fan in a sick person's room, but you can also have fans pulling air in one direction and pushing air in the other direction in different rooms to really control the directional airflow through your house. And by choosing which rooms have the suction versus pushing air through, you can ensure that that everybody gets air that's safe for them or isn't at risk of infecting other people. And as I said before, choosing where you put your air filters, putting the HEPA filter directly in front of a sick person's room is not just useful in terms of having a filter cleaning any air that is escaping from their room despite the fan. It's also a really good physical obstruction that reminds everybody going past or going into that room, oh, this person is sick. Like there's no other time in our lives where we have an air filter fully obstructing someone's doorway. The only time we do that is when somebody is sick. And so it's like a practical and obstructive reminder to check your PPE before going into the room. So it sort of serves a bit of a double purpose, putting a filter right in a doorway when someone's unwell like that. That's all I've really got to say tonight. Thank you for having me, and thank you to Hannah and to Dr. Alberto for all of the guidance that he gave us.
Thanks, Joe. That was, gosh, well done to your husband. That is very clever, very handy. And I love the positioning of the filter on the tire of the bike box. So, very well done.
Yes.
Thank you so much, Joe and Alberto. That was honestly so thoughtful and practical, and I'm sure our members will really got some handy tips and tricks out of that. So thank you so much. I think that it would be good. I know that a couple of questions were submitted prior to the session tonight, so I might just ask those to you both and see where we go. And if anybody else has any questions, feel free to pop them through to the chat as well. But the first question that we had come through was a question around safe access to healthcare settings during periods of increased airborne infections. Any suggestions there?
I can make a comment to that, Hannah, of course, but Joe, please go right ahead. Look, effectively, seeking medical assistance when you have a concern is key. And in fact, it's a must, and we do recommend to do so. Many of you may or may not be familiar with the fact that we do recommend to many of our patients to have almost like an action plan where the type of immune deficiency is highlighted and is identified. When you're attending a medical service, obviously there's going to be a lot of patients that are unwell, and we do recommend to be cautious when you're presenting. And so I have patients where the degree of concern is significant, whereby we recommend, in fact, we notify the hospitals before they to present that this patient has an immune deficiency. The patients are highlighted and then they're actioned quite promptly. But if you were presenting for assessment and that's not possible, it's important that you protect yourself. And putting the measures that we discussed earlier would be key. I do suggest that you wear a mask, at the very least, if you are able to do so. And of course, it's important that you highlight yourself so that you're not sitting there and waiting like everyone else to be assessed for, an abdominal pain or a, migrainous headache and so on.
No, perfect. Thank you so much. That's so handy. Yes, Joe?
I just wanted to add exactly what Dr. Alberto said. I don't think that this is only a winter thing. As an immune deficient patient, I do seek medical care, sometimes emergency medical care, at any time that that's necessary. And that could be my problem might be a respiratory illness, but my problem might be that I've cut my finger and need stitches. You still have to go to the emergency room when you have to go to the emergency room. And particularly with hospitals versus my local GP practice or a specialist, at any time of the year, I will assume that there is going to be someone significantly infectious with something that I really, really do not need to catch in an emergency room. So I am absolutely meticulous with my mask wearing. And if I need to eat and drink while I'm waiting, I will go outside to eat and drink and come back inside afterwards. And of course, I've always got hand sanitizer on me, and I'm paying attention. Like if I've been touching surfaces in a hospital waiting room where you can clearly tell, at times you can quite clearly tell that someone's got gastro. I'm really, really careful with hand hygiene in those circumstances when going to hospital. But as Dr. Alberto says, you have to go. You can't not go, but you can be careful while you're there. And I always let them know that I'm immune deficient, particularly now. It's quite interesting having just moved from Melbourne to Adelaide. These are cities that had different experiences of the peak COVID era. So in Melbourne, when I would appear in healthcare settings with a mask on, the response was actually usually to assume that it was for my own protection. And so people would say, "Oh, you're wearing a mask. Should I wear a mask?" Whereas in Adelaide, people see me wearing a mask and say, "Oh, are you sick?" And so that's a localized difference that's been quite interesting in moving. But I always tell people, particularly if I'm in a hospital versus my local GP office that already knows me, I have an immune deficiency. I am wearing a mask to protect myself, so that um, they know why I'm wearing a mask and also that I'm vulnerable.
Yeah, exactly. Yeah, perfect. Thanks, Joe. Thanks for sharing. One more question that did come through might be for you, Dr. Alberto, but the question is just around nasal injections. Are they effective?
Is this perhaps about the intranasal influenza vaccination, possibly?
Potentially, yeah, potentially.
So the influenza, so there's many different types of vaccines, as you know. For most of us, for our patients that have immune deficiency, we do recommend for them to have the inactivated or the kill vaccines. There's a number of vaccines that are what we refer to as live attenuated vaccines, which is usually a viral illness that has been somewhat weakened, and then it's injected or given a different way so that we get a mild infection and then generate an immune response. Vaccines like these include measles and mumps and rubella, the chickenpox vaccination, the varicella, and the influenza vaccine that has come this year, that is intranasal. So it's a spray for the nose. It's the live virus, influenza, that attaches, replicates, and gives you a mild flu illness. But then if you're immune competent, your immune system will pick that up, clear it up, and you have immunological memory. So it's perfectly fine for those of us that have complete immune function. For those of us that have an immune deficiency, the risk is that you're actually giving yourself an infection without the need for it. And it may go okay, but it may also cause significant disease. So we'd recommend not to have the intranasal influenza vaccine, which is called FluMist. I'm hoping we answer the question, and if that
Yes,
is
definitely. If it's not, yeah, we'll definitely get back in touch with them. But yeah, thank you to everybody who did submit a question prior to. And we have had Kimmy, who's on the session tonight. She mentioned that she has the Winks air filter and replaces the filter screen monthly, and definitely recommends that eucalyptus spray is beneficial as well. So thank you for sharing that, Kimmy. Are you familiar with that one, Jo? That brand as well?
I have heard of the Winx ones. Yeah, there are a number of different brands that seem quite reputable. And I think one of the most important things when choosing a filter for your home is just really doing your research to add up the size of the airspace that the filter is intended for, and making sure that you've chosen a filter that's suitable for the space. So we've got 2 or 3 different sizes in our house. We've got bigger ones that are used in the more open plan areas, and smaller ones that are for a bedroom. Particularly if my kids have got someone visiting, they won't necessarily have an air filter running in their room because it's noisy and it uses power. But if they've got a visitor, then they'll turn it on in their room, and they've got a smaller one that's just big enough for that room. We also have one that's the size, suitably sized for a hospital room, so that when we're in hospital in a private room, we can have the filter turned on.
Amazing. Thank you so much. So thank you again for those questions and addressing those, Alberto and Jo. Thank you so much. So before we move on to the final part of the webinar, I did just want to run through some of the available IDFA resources and support. So feel free to scan the code. You can also access all of these resources via our website resource library. But yeah, there's a lot of things that are relevant to what was discussed here this evening, and lots of other handy tips and tricks and guides that we have, including our Stay Healthy, a guide for patients and their families. And then there's also a guide for schools as well, which is really handy. But yes, feel free to access these resources whenever you like. So some of you might have heard of the IDFA Coffee Club. So Coffee Club is a welcoming in-person gathering for members of IDFA in the community. So providing a bit of a relaxed space, an opportunity to connect and share experiences with some other members that might be in the area with you. So it's a great opportunity if you think that's something that you might like to see, if there's one running in your neighbourhood or in your local community, or if it's something that you might like to host. We can definitely help you with that as well, but feel free to scan the code and check out all the resources for that as well. Otherwise, you could definitely reach out to me and I'm happy to help you go through what we have coming up, and if it's something that you want to set up for yourself, we can help you with that as well. The other program that we have is our Circle of Support. So this is an awesome initiative that supports our community, and it's a free one-on-one peer mentoring program. So it's really helpful for IDFA members. It helps strengthen their self-management skills and social emotional well-being whilst living with an immune deficiency. So we partner you up with someone who has an immune deficiency in your community as well, and they can act as a bit of a mentor for you. So if this is something that you're interested in learning a bit more about, or if you feel that you'd like to be a mentor, we have the training ready to go. So yeah, there's a lot of information about it on our website as well, but again, feel free to reach out to me at any time and happy to go through it with you. Does bring us to the end of tonight's session. I just wanted to say a really big thank you again to our presenters. So Dr. Alberto, thank you so much. And Jo, thank you so much for sharing your experience and all those handy tips and tricks. So we really, really appreciate your time this evening, and for, speaking to our members. We really, really appreciate it. We really do hope that you all found this session really valuable. We will be able to, if you do have any follow-up questions, feel free to contact us via email, and we'll be able to filter those back through to Dr. Alberto and Jo and come back to you. But yes, we just want to sincerely thank you again, and a big thank you to our sponsors, Grifols, for giving us the ability to host this session and the ongoing webinars that we've got coming up. So thank you, everybody, and I hope you all have a really good night.
Thanks,
Thank you.
Hannah. Good night, everybody.
Bye-bye.